We are Bitehaus Dental, a modern dental clinic located on Sinclair Avenue West in Toronto.
Bitehaus Dental was referred to us from one of the Apple stores. They know that we specialize in medical and dental services for the Apple environment, and that's why they reached out to us.
Our dental clinic was developed with the idea that we wanted to incorporate all of the modern technology that dentistry had to offer.
When I was having the conversation with Dr. Whitaker, I understood that they have a vision for this clinic to utilize technology to the fullest.
Our goal at Bitehaus was to make our experience as comfortable as possible for our patients. So when we were choosing what X-ray systems to use, what digital softwares to use, a really big important part of that for us was low radiation, comfort, and efficiency.
They wanted to have a full experience for their patients. They wanted to have all their X-rays integrated into their practice management system. They wanted to be able to take the panoramic pictures and the local X-rays all into the patient files, accessible from everywhere, from every single op room, and also from the back office if they're doing some research, if they're preparing some estimates for the insurance. They needed to have the use of the technology, everything, the use of multi-zone music in the clinic, even sterilization stations. They needed to have that all connected into their digital system so that they can have full control over the environment.
Set up here at this clinic, we have a very nice setup where we have the computer and the patient's chair working together. If we are doing X-rays or taking a look at the patient information on the computer, we can then pull it up so that the patient can see exactly what we're talking about and what we're looking at to make sure that they understand the full procedure that they're going to be getting into.
So the doctors and their assistants will use their X-ray machines, and they will all come directly to the machine that they're working from. But from there, they all connect directly to the Mac Practice servers that they have in the background. From there, they can access any of the client's files on any of the machines afterwards.
As well, in between times when they may be sitting waiting for the doctor to come in and look at them, or waiting for some other information, we're able to pull up entertainment on here. You can have Netflix or YouTube, different things, just to create a comfortable environment for them while they're waiting for information.
There are so many challenges in this new digital age. We experience internet outages in our neighborhood as it's still developing. We also have issues with updates in softwares as well as the operating systems of our computers.
When we took over support of the clinic, they had a lot of network issues. A lot of them were wireless issues as well as wired, which would mean that they can no longer access patient data. If they were in the middle of a session or someone was just coming in and they were trying to get that information, it was not accessible to them. To resolve this, we first took a look at the overall network to see what the problems may be. We then addressed the wireless and the wired network at the same time, putting in new hardware for the wired, making it much faster and more reliable, as well adding new hardware for the wireless, making it much more accessible and stable than it was.
There have been many times where we have had to improve on the hardware and software that we have. But it has been pretty seamless, and we've been able to do that only because we're with a company that we are comfortable with and confident with their choices and recommendations.
When I had the first call with Dr. Whitaker, I understood that she's having real difficulties with her current IT provider because she feels that they don't really understand the Apple environment, and that was the major thing. They use Apple, and to be very clear or very simply put, if you don't know your way around the Apple Mac environment, you don't really know how to support it. It's as simple as that. It doesn't matter if you have all the knowledge in the world about putting wires together or basically even assembling computers. If you don't know your way around the environment that you're supporting, you should be supporting. So we stepped in, we took a couple of measures. We tried not to make them extreme measures. We approached the support aspect gradually so that they don't have a big drop in service or a big shock in their learning curve, and that was essential.
For us, one of the easiest parts of working with Alary has been communication. They are there at the end of a phone call or email or even a text message on days where things are really urgent. And that's really critical for us because if our technology goes down, we need it back up within a number of minutes.
As any project like that, when you're taking over from a service provider, one of the challenges are you have a running business. They have patients every hour. It's not starting fresh, and that's the biggest challenge. Plus there's a learning curve as well, so we had to take it step by step in introducing the changes to them. We start with the operating systems and how we're going to upgrade them to something more modern, more secure, while keeping them operational at the same time. The same with the network. We had to make some changes to the network, but at the same time we couldn't just take everything out and replace it. So we did it over phases, and also we had to work some evenings and weekends to accommodate for those changes and without interrupting their systems.
So for us, the confidence in the relationship has been paramount. There have been many instances where, on awkward times or awkward days that they've been able to turn things around for us and get them back up and running. That allows us to not have any outage days in terms of seeing patients, and be able to just continue to work as smoothly as possible.
How a clinic is run, we understand the importance of the patient's files. We understand how to link an X-ray machine, for example, to the Mac practice. We understand how much data is required from all those X-rays and the 3D panel images. Intraoral cameras, all of those things connect together, but we understand them. When we're doing the troubleshooting, that is very important. When we're estimating the size of storage we need on the server, that is very important. Even things like notifications to your patients from your calendar or cancellation event, all of those things, we have to understand how a clinic is run. The most important thing for clinic owners to think about when they're starting a clinic is involve a technology consultant early in the game. This should not be an afterthought. This should be, as you're talking to an architect to design your space, bring in a technology consultant. We do it for free. If you want to come to us, we'll be happy to utilize that as part of relationship building. We will tell you everything we know about building a clinic. We do this every other month. We build a network for a clinic. We put together technology. We build relationship with a lot of doctors and dentists on how they would like to set up the clinic. The most important thing is it should not be an afterthought. It should be at the beginning.